Thank you for joining us for this virtual news conference. We appreciate your efforts to help us share the most accurate and up-to-date information with our community. I also want to thank our interpreter today. Sharon Sinkler is back with us, as well as our interim health director, Pat Lopez. She and several other folks from the city and county staff are available to answer questions as needed throughout the conference. We are here today to update you on the status of COVID-19 in our community and our response to it. As we shared yesterday, Lincoln now has a third lab-confirmed case of COVID-19. And in its investigation of this third lab-confirmed case, the Lincoln Lancaster County Health Department has determined that the individual has no relevant travel history and no known source of COVID-19 exposure. In short, this is Lincoln's first community-acquired case, and with this comes a new phase of action in our community's response. Today we are announcing a new directed health measure, very similar to the one that is under which Omaha is operating, and this directed health measure is effective tomorrow at 8 a.m. We have known that the presence of 1 to 2 community-acquired cases would be the trigger for this step, for a directed health measure for Lancaster County. Our public health officials worked closely with infectious disease specialists at UNMC and the governor's office to identify this as that trigger, as a guideline for our response. Rather than wait for a second community-acquired case, however, Lincoln Lancaster County Health Interim Director Pat Lopez is ordering the directed health measure and is here to discuss what this means for our community, as well as to provide you with additional details about this third case.
Good afternoon, everyone. The third positive case in Lancaster County is a person in their 50s. As the mayor said, has had no known travel or contact with a COVID positive case. This individual is hospitalized and receiving care at this time. All of his immediate close contacts are self-quarantined. Those in Lancaster County now, we have 3 positive cases, and we are currently monitoring 177 people, either through travel history or exposures. And we have 6 pending tests in the Nebraska Public Health Lab we're waiting for results on. This doesn't include tests that are being done in other labs that we are receiving information on. That's the information we have now on the case. As we have been saying, the first case of community spread takes us into another phase with greater restrictions that are needed to prevent further spread. The measures we are ordering today are similar to those issued by Douglas County Health Department earlier this month. We will be contacting the impacted businesses directly with guidance on complying with the measure. As of 8 a.m. tomorrow, the following are not allowed in Lancaster County. Gatherings for any reason of more than 10 people in single spaces, including schools, daycare facilities, and in-home facilities, fitness centers, gyms, auditoriums, stadiums, arenas, and large event conference rooms and meeting halls and theaters and libraries. Gatherings for any reason of less than 10 people in single spaces with a maximum of 6 feet between all individuals must be maintained. And we'll have a full list of all the areas that are impacted this available after the press conference. And you'll be able to find them on the website at covid19.lincoln.ne.gov.
We know that the changes in our response can feel abrupt, and that's because they're being made in the context of very rapidly emerging new realities for our community. Entering this new phase of our effort, this phase of initial community spread, is something we knew was coming. We know from watching other communities across the country that once you have that first initial case of community spread, that more larger scale community spread comes next. And that's why this moment and this directive are so critical. The virus will begin to take a greater hold in our community soon, and with it a greater toll, but we can each do our part to minimize that toll. We are confident that the people of Lincoln will adjust to this next phase of our efforts to defeat this virus, because that's what they've been doing every step of the way. We know that you will have questions about enforcement of this new directive. And while we fully expect that the people of Lincoln will do the right thing, just as the people of Omaha are doing the right thing, we do need to be forthright with you about the fact that this measure does have the force of law. In everyday life, however, primary enforcement will look like the health department officials reaching out to ensure that people understand the directive and respectfully requesting that they comply. Health officials will provide education to those who need it about why this is so vital to our community's safety. Last resort enforcement will be with the assistance of the Lincoln Police Department or the Lancaster County Sheriff's Office. We do not expect this to be necessary because we know that Lincolnites want to do the right thing. And we know this because so many of them already are. We're fortunate in Lincoln that we moved to social distancing very early in the arc of this pandemic. We feel that we've taken a number of steps already, many voluntarily, that put us in good stead for this next phase of the effort. And we do want to acknowledge, though, that this next phase brings hardship. We know that local businesses and employees are already experiencing the economic impacts of this pandemic. We are working hard with our federal and state partners to provide access to federal and state resources and local resources that will help address impacted businesses and their employees. Again, those resources are being compiled at covid19.lincoln.ne.gov. Resident resources and business resources can be found there. In the face of our shared hardship, we in Lincoln can feel fortunate that we have had more time than coastal American cities to make our preparations for this pandemic. Many of the steps we've taken, from school closing to businesses curtailing their operations and the cancellation of large public gatherings that have already taken place, again, put us in a strong position as we move forward. And while COVID-19 will run its course through our community like it has through others, and that the days ahead will be hard, these social distancing measures are the very measures that will mitigate the full impact of the virus and that will see Lincoln through to our eventual recovery. In the meantime, this directed health order will present new challenges and ask for new sacrifices. It's important to remember why we are so committed to comply with them faithfully. What each of us does right now is important and has implications for what happens next. Each of us has a heroic role to play in preventing our healthcare system from becoming overburdened and in saving lives. As we seek to rise to this challenge, our resilience and the Nebraska way of lending our neighbors a hand will serve us well. I urge all of us to look for opportunities where we can to help with the physical needs, emotional challenges, and the sense of isolation that others are experiencing as we navigate the pandemic. The situation is fluid, and we are adapting as we go. Life won't get back to normal right after this pandemic, but neither will it stay like this forever. With that, I want to mention that we have people here to answer questions. We have representatives from the Sheriff's Office. We have our Chief of Police here, and also Pat Lopez can answer more questions specific about the order.
We have a question from William Padmore at KLIN. What are the consequences for disobeying the order? Also, how many warnings does a person get before police enforcement is necessary?
Let the Chief take this.
Good afternoon, Jeff Blymeister, Chief of Police for the City of Lincoln. The question posed by Mr. Padmore is contained within the order in far as the penalty components. And non-compliance, which once again, to reiterate what the mayor just said, we fully expect there to be compliance. But in the event that there isn't, this is a city misdemeanor if the establishment or the violation is within the confines of the city limits of Lincoln, punishable by 6 months in jail or a $500 fine or both. Once again, that's on the most extreme of circumstances. Mr. Padmore asked the question, how many warnings will there be? Once again, we go back to the initial response will be by the health department. When the health department staff goes out and evaluates, they will document those efforts, and if we will evaluate every single facts and circumstances differently. If the non-compliance continues, then the potential for a citation does exist.
I have a follow-up question. If people see something that appears to violate the order, who should they report that to?
Once again, there are very specific parameters contained within this document, and all initial reports should be made through uplink. And that will be part of the messaging that goes out, where Director Lopez also indicated that it will be posted on the COVID-19 page. So uplink is the answer.
Riley with the Journal-Star with a question for the chief, or whoever wants to take it. The complaints already that have been filed on Uplink, what's been the process with those before the directive became necessary?
Sure. I'll turn that particular question over to Pat, and I can try to help out too.
Good afternoon, Riley. Primarily right now, what we have done is provide education in most of those cases, and situations that were maybe larger or of a different nature, then we've consulted with our law enforcement partners for direction. But it's primarily been an educational process for people.
Any other questions?
Riley with the Journal-Star again. With the community spread stage now here, what is the sort of tracking for each individual case that comes forward? Will there be information shared with the public about the new diagnosed cases and their potential exposure locations? Or can you speak to the protocol with that now versus what the city had been operating under?
Yeah, I mean, our objective will be to continue to provide up-to-date, timely information so that we can protect the public. I'll let Pat Lopez speak to any potential anticipated changes in, I think your question's about as the load of cases grows, correct? Like, would there be any shift in how we communicate? Is that right?
Somewhat, and what's different now versus the exposure locations that may existed with the initial cases.
Okay.
Investigations.
Riley, thank you for asking that question. I wanted to emphasize to everyone that the person who, our third case that tested positive, had really had any very minimal, if any, community contacts, and primarily that was with his medical provider. So we've been fortunate that people are listening, and if they are developing symptoms or have symptoms, they are self-quarantining. We will continue on each case as things move forward and reevaluate, but we are doing full investigation on every case and contact history as we receive them. So we won't be changing anything that we're doing now and have been providing to you at this point in time.
I have a question probably for Pat. Can you explain the difference between presumptive cases, presumptive positive cases, and lab confirmed cases, and which we are keeping track? Which of those are we keeping track of?
We're keeping track of lab confirmed cases. That means that an individual's gone in and actually had a test done that confirms that they are positive for coronavirus. The presumptive,
Presumptive positive.
okay, presumptive positive is a term that's are presumptive cases. And those are cases, maybe individuals who probably have tested negative for flu, influenza test, and had a negative respiratory panel, but were not in the area where they needed to have COVID, the actual COVID tests done. And we have very few of those being reported. Physicians are really primarily working on with those individuals who are at the highest risk that we've identified previously and taking care of those members. We've also been working to grow the testing amount that's available in the community as well, so that we have options for people to receive testing.
And the follow-up is, why are we not tracking presumptive positives?
There is no mandate for providers to provide presumptive positive numbers. And right now, as I said, our healthcare community is really focused on treating those individuals and getting in contact with us about those who are in those high-risk categories and need additional testing.
Next question is about asymptomatic folks who have no symptoms, and if they can spread the virus.
We don't have clear documentation from a medical standpoint about that at this time that I can answer. And we'll continually review that material and provide updates. I think we all need to remember this is a new virus, and we're learning sometimes hour by hour about it and what symptomology is there. So we are continually updating the website and providing the most current information on there, because we really want the public to have the accurate information.
KZUM, question from KZUM. So within Uplink, there's 33 listed COVID-19 public gathering concerns, and within those status updates, whether they're being acknowledged, closed, etc., what's the threshold for closing a complaint?
I think I could try. Kurt, is that you that was asking that question?
Yeah.
Let me try to do this, because this is very similar to many of the processes for uplink complaints that the Lincoln Police Department currently investigates. So if there is a purported violation of this directed health measure, health department employees are going to respond to that, and they're going to complete an investigation, and they're going to determine whether it is within the confines of this document. If there's a violation, undoubtedly there's going to be some ambiguity that exists, and I know from conversations that the health department is focused on providing continuity in that particular enforcement. So if they would respond, there isn't determined to be a violation, then that complaint would be closed. Hopefully that answers the question.
Sorry, I didn't quite catch your whole question, Kurt. We are following up. We have somebody who contacts the individual, and based on the nature of the complaint, we use some of our specialized staff to respond to them, as I said, and do the education or whatever process is needed, provide them the information that will assist them. And in those cases where we're not able to respond, then we go to the appropriate entity that can do that.
Pat, once you stay there, Riley also wants to know what we know about the emeritus case that was reported yesterday.
What I want to say is that we did not report an emeritus case. We do not have any lab-confirmed cases that relate to anyone employed at emeritus, and that's about all I can say, that we have no information, and we do receive the information on every positive case in Lincoln and Lancaster County.
Every lab confirmed.
Positive case. I think what is clear is that we're using community-acquired cases as a proxy for a growing prevalence in our community of COVID-19. Without universal testing, we can't say for sure how many people have it, but we can report accurate and timely information about lab-confirmed cases, and we will continue to do that. And we're taking this seriously. This directed health measure is not about being punitive, it's about being protective. We want to make sure that people understand that we are entering a new stage where community spread is likely to become more significant. I want to thank the public for taking so many preventive, precautionary steps that put us in a good place, that make it less likely that we will be seeing the kind of chaos that is occurring in other communities. But we know that things are going to be more serious from here out, and we want the public to pay attention, to take this more seriously, to look out for one another, and help us fight this virus and get through this pandemic together.
How about another question from William Padmore? Clarification, businesses affected are being ordered to close as opposed to being recommended to close, which is accurate.
We've already made recommendations about the distance spacing and gatherings, and this is an order.
We have another question from Riley. Does the directive have any differences based on how the Omaha's measure has played out thus far?
The measure that we have put in place is similar to the Omaha measure.
And we think that's
We are working in collaboration with public health officials across the state, and we want to make sure that the messaging to our community is consistent and clear and easier to follow. It's really important for people to understand what's being asked of them during this time.
Any other questions? This is in effect until May 6th. I'm not sure if that was shared. We want to make sure you know that this is
6-week endeavor. We'll reevaluate at that time what the future holds. But again, this is a time of challenge for us, but it won't last forever. We will get through this together, and we appreciate the collaboration and compliance of people across Lincoln.